Yeah, it's like
the shark bite from our
Yeah, well, I was going to say it's like PS Red.
I'm becoming a good little mixologist.
Yes.
I love it.
I hope you all, if you aren't at work, or maybe even if you're at a cubicle, you are drinking along with us.
Whether it's water, adult beverage.
Someone asked me recently, like, is it actually, like, are y'all actually drinking alcohol, or is it just like, no, nothing we do is just for show.
Yeah.
We do the real things.
Legit. I'm going to make sure we can see comments.
Okay, Jess. So while you do that, what's going on? What's going on here at the office?
We have some new and exciting things going on.
We really do.
We're like bursting at the seams to tell you guys. So
I know.
Today was perfect to do it. So
yes. So, and also last week we talked about, or 2 weeks ago, and I feel so bad because I lied. I said we're going to do it next week, which was last week, and then we had a staff meeting that I totally forgot about.
Yep.
So we couldn't do it. And then we actually tried to do it at the meeting with Dr. Sukar, but it just logistically couldn't work out.
Yeah, it was just too much.
But just know that that's the plan, y'all. Every Friday, 12-ish, 12:30-ish, we'll do this.
You know, our ish.
Yes. So please remember to share and comment. And I think we're going to have some giveaways. So please share, comment, and we'll do giveaways for sharers and commenters.
Yes.
What are we going to talk about today?
Some intoxicating things around the office.
Yes. Okay. So last week we talked about lip fillers. This week we're talking about toxins.
It's not really scary, so don't let it.
It sounds, like, oh, that, like, you can't eat crayons because they're toxic.
Right.
I mean, you wouldn't eat crayons.
Okay. Are they non-toxic?
I wish
non-toxic.
this wasn't live right now. Okay. Anyway.
In other news.
Yeah. So, wrinkles. Let's talk about wrinkles for a second.
Nobody likes them.
And no one likes them.
Not in your clothes and not on your face.
And as much as, men like to say, oh, it makes me look distinguished.
No.
We don't like wrinkles.
Mm-mm.
And, your facial expressions, the more animated you are, the more your collagen is losing its elasticity over time.
Say that faster. 3 times fast.
So it happens. It happens to everyone. Whether it happens when you're younger, not until your 40s, everyone's going to have wrinkles. I like to say that, and Jenna and I decided that I'm a Botox baby because I started pretty young. But what that's going to do is just prolong my wrinkles even longer.
Yep.
So
not going down without a fight. So.
Super excited about that.
Yeah.
But that was probably the first thing I ever got when I jumped into this world, and also the most thing I've got.
It's frequently
because it is addicting once you get to that.
Once you start seeing those lines on, you're like,
like, oh, I don't miss those at all.
Nope, say it back. So what is a toxin though?
Okay, so I did do some research. I'm actually the sciencey one today.
And I told Ashley, I was like, I think you need to wear the science glasses in the today.
So back in the 80s, neurotoxins have been used for a long time. Back in the 1980s, Dr. Alan Scott was the first to start using it as like a paralysis for muscles. And it's a naturally, what's that word, that big word? Botulinum toxin.
Botulinum toxin. Probably butchering it, but that's the direction it goes in.
So,
hormonally.
Yeah, it's a naturally occurring protein that does that pausing of the muscles. It kind of like stalls it so that they aren't moving and you're not seeing all those little lines, those deep lines. Jess, you want to take over on the smart stuff?
Yeah. So, all right. So, what is toxin? So, Ashley kind of gave you the backing, when it started and where it kind of came from. But the toxins that we offer here at our practice are Botox, Dysport, and we have a new exciting one.
Announcing new tox.
Jeuveau.
It rhymes with hello.
It does.
Well, it says it in the pamphlet.
Oh, I
didn't
read the pamphlet.
Because you see the name and it's kind of like, kind of weird, Jeuveau for all my classy ladies out there, it comes from Nouveau, which is a word that means modern, new.
Mm-hmm.
So Jeuveau has been, if you've seen it on Instagram, on Facebook, they have this campaign going about Neurotox.
Hashtag.
Yes, hashtag Neurotox. But super awesome, and we'll talk about that later because my girlfriend has actually gotten it already and loves it.
Day 8 Neurotox Jeuveau.
I wanted to get some too, but
we were
this
really
is as much
busy
as I can
yesterday.
move. So
Yeah, and you're not due for it yet. Not quite.
no, not yet.
But a little longer.
Yeah.
So, all right. So the 3 toxins we offer, I did mention those. That's Botox, Dysport, and we offer Jeuveau. And
So Botox has always been considered the Coca-Cola of toxins. It was the first one to be established by Allergan and Dr. Allen, and it's also still the one that people come and ask for by name.
exactly.
But, and up until a couple weeks ago, the other toxin that we offered here at PS is Dysport.
Mm-hmm.
And Dysport, we always say, you know, Crest and Colgate. Everyone has a preference, but
Exactly.
it's really, it boils down to the proteins. Actually, it boils down to
It's the proteins and how it's preserved, basically, as far as when it's manufactured and when it's made.
and there's
So
pros and cons for each one.
right, and it's not that necessarily one is better or worse than the other. They're all equally great. Just like Ashley said, Crest and Colgate. It's like Nike and Under Armour. They're both fantastic athletic brands, but you may like Nike's athletic wear and
It's
Under
like
Armour
a really
shoes.
weird comparison. That's
I
like,
know, but it's the best way to know how to describe it. I don't know.
Under Armour is so unpopular though.
What?
Do you wear Under Armour?
Yeah.
What about like?
And Landon,
What about
you said-
Adidas?
Oh, I do wear Adidas. Yeah.
Anyway. What
So, you know, anyway. So they are all great. They're all equally great. There are some slight differences between the 3, and I will tell
and
you
it's in
that
the medical makeup, right?
and like exactly how it's put together, how it's made, manufactured. Yes.
And then the units are different. That's one huge difference when people come to our office and they get Botox one time, and then the next time they get Dysport, and they're getting 3 times as many units, and it's like, wait a minute, something weird here, or are y'all trying to pull a fast one? What's going on?
Yeah, so the units conversion between the 3, you may notice if you've ever had Botox or Dysport, is going to be a little different. The units conversion, as far as you know, when we're injecting, is going to be with Jeuveau. It's going to be the same as Botox. So let me just kind of give you an example. Botox, if we were to do 30 units of it in a patient, and then they were to come in the next time and do Dysport and want to do the identical treatment, it would be 90 units. So it would be 3 times more. However, with Jeuveau, if that 30 unit treatment is normal for you for Botox, it would be a 30 unit treatment of Jeuveau. Okay? So, that makes sense?
It makes sense, and that's going to be easy to remember. So I'm
Mhm.
glad our new toxin that we're introducing is going to
Seamless
be
transition.
definitely.
Mhm.
And so is that one just like, what's a third toothpaste brand?
Oh, God.
Crest, Colgate.
That's crazy. I can't even think of another brand.
Well, for toxin, it's Jeuveau.
Exactly.
So we're really excited about it. They have a really fun campaign. It's the
gosh,
new
yeah.
toxin. It's all pink and red and cute, and we have pink gloves for it. So we're officially launching as a Jeuveau provider.
Yeah.
I'm super
Okay,
excited
so
about
let's talk about
FAQs for
okay.
Botox.
Yes. Okay. So a lot of times when patients call, they want to know how long is their treatment going to take, because we are all in a hurry. We got things to do. We need to get on to the next thing, right?
Could you do this during lunchtime?
Absolutely. You can even do it before work. You can do it after work. You can sneak in on like a 2:30 break, a 10:30 break. It's a super quick treatment, although we don't rush it. We want to make sure that we're, injecting the proper dosage and units for you. But an average toxin treatment is about 15 to 30 minutes. So just really, everybody's a little different. Some patients need a little more time. Some patients, they're good with, it's 15 to 20 minutes is about how long it takes to do the treatment. So average is about 15 to 30 minutes for a treatment of a toxin, whether it's Botox, Dysport, or Jeuveau.
Now, if you haven't had it done, or if you're going to put it in a new area, we definitely are going to book out that full hour if you need it, just to talk over your options. talk over the places it can go, talk over how much, what you're looking for. Obviously here, myself, I love the Frozen look because I am Princess Elsa.
I was like,
but you might want some movement. None of us have completely frozen. We all have movement. We can all show our emotions.
Exactly. I like to have just a tad bit of movement so my kiddos know.
Whenever I see exactly,
I don't want to make any lines letting them know they're in trouble, but I just want to let them know slightly that.
Oh yeah.
Straighten up.
Whenever you see, have you noticed that whenever anyone talks about Botox on TV and movies, especially like back then, it was just something that would make you look like this, and you always had your eyes open and you just talked really funny.
I think that's a huge common misconception.
It's just
with
total common misconception.
Yeah.
I'm confessing, I was recently obsessed with the show Frasier. Yes, the one from like the 90s. Like I was obsessed, and so I binged it all.
Before she was born.
Yeah. But they did have a show on plastic surgery, and he ended up, one of the guys ended up dating a plastic surgeon, and he got some Botox done. And so just the entire episode, he was just like this, and he couldn't, and then someone died in it or something like that, and he just looked at everyone like this, and so everyone just thought like, that's a terrible product. It was very just...
That's an awful... I guess
it's such a beautiful, amazing thing, and he was just poo-pooing on it.
Oh, man.
But it's because a lot of people aren't educated.
Exactly. I'm going to read a few comments we have here real quick. So, let's see. Actually, let me see if I can see up here. Let's look. Oh, I may have to translate in Spanish. Ooh. Let's see. Love y'all. We love you too, Courtney. And let's see. Oh, Sensodyne. Dang.
Oh, Sensodyne. Could have said that.
Man, how did I miss that?
Okay, so Jeuveau can be the Sensodyne.
Yes. Okay, so
let's see. Que lindas modelos. Oh, thank you, Tia Lala. Oh. She said that we're very nice and pretty.
Shannon said I want some. Yeah, Shannon, you need it. You guys need to hang tight till the end of this show. We're almost done, I promise.
Because
Angela
we have something exciting for you. Very good question, Jess.
Okay, let's see. I want to try Botox again, but had it done and made me look angry. Is that normal? Well, Angela, give us a call. We'll chat with you, kind of see what's going on with your, as far as like what you had done last time, and maybe there can be some adjustments to this treatment. But it definitely shouldn't make you look angry at all.
Right.
Most people, when you get everyone, when you get Botox, no one should really know that you got it, besides the fact that you're not creating deep lines and wrinkles, and that your forehead, between your brows, and your crow's feet are looking very smooth. So,
see, the lines that are up here usually, and I think it's so funny. My boyfriend knows how many lines he has on his forehead.
He counts his.
He's like, wait, is there more than 7? Like,
well, we need some Botox, some Jeuveau.
Definitely need some Botox. But so those lines are gone. And these lines right here, I used to have really deep lines right here.
My husband called mine my mean wrinkle. I'm not really a mean person, but he would call that my mean wrinkle. So
what do you think the angry face, is it just like super far back, like maybe too much?
There's hope. Thank you. Yes, the lines is what I want gone. Perfect, Angela.
Yes.
Angela, give us a call. Our phone number, if you want to write this down, and we'll put it in the comments, is 281-990
8487.
Yeah, so just give us a call and we'll
give us a few minutes, because we are going to announce some fun.
Do not get off of this live, because we have something super exciting to share with you guys.
Like a really special.
Yeah.
Good thing Dr. Sukar isn't here today, because
I know
he'd freak.
I'm gonna tell you. Okay, so oh my gosh, Courtney. You're our best friend.
Okay, Miss Shannon said, what about if I have hooded eyes? Does it make them worse?
No. Okay, Shannon, here's the deal. Thank you, Courtney, for putting that down there for us. Angela, there's our phone number, and Courtney, put it in the comments. Okay, so Shannon, as far as having hooded eyes, I will tell you, I have hooded eyes as well.
Me too.
And
well, I will, because my mother and my grandma.
But the true hooded eye is just whenever you open your eyes, you can't really see your crease, and so we don't have as much real estate from our lash line to our eyebrow. So someone who doesn't have hooded eyes, you can literally see their entire from lash to lid with their eyes open.
Did you mean to make your eyeshadow Jeuveau color?
I did, actually.
That's really
that was
really
on
good.
purpose.
Yeah, that's really good.
A little tequila sunrise. So
it does look like okay.
Exactly. So Shannon, so I have hooded eyes as well. It doesn't make mine any worse.
We're
reading comments.
We're like
Look
leaning in. Look at the
leaning in.
no wrinkles
We're zooming in. So Shannon, if you have hooded eyes, the answer is no. It's not going to make them worse. And when we put our makeup on, we disguise those hooded eyes and we make our eyes look more open by how we apply our eyeshadow. So whenever we do the Jeuveau, whether you have shadow on or not, it's not going to make them look worse. Sometimes we're actually able to elevate the brow just a bit to take some weight off the crease that's creating that hooded eye. It's not going to make them go away, but it may give your brow a little bit of a lift on where we inject. So that's a positive thing. So good question. I like that.
Another just sidebar. One time we put Dysport, I think, on my chin.
Mm-hmm.
And so if you've ever like when you go like this and you have like the
little dimples,
orange,
orange peel.
like an orange peel, if you feel the little dimples, it's like really tiny dimples. And so I had that like very severe on my chin, and now it's like my new favorite place to put it is the chin. Because there's nothing there.
I'm always just like, let's get this taken care of.
Yeah.
But that brings a good point that you had it injecting your chin. So there's actually several places on the face that we inject. So let's go to, that's one of our frequently asked questions. Where is it injected?
You can put it in your lips, right, Jess?
Absolutely not. That was on our Mythbusters.
Yes, we went over that yesterday. Botox does not go in your lips. I wonder what it would do. It would make your lip like...
Well, since toxins stop muscle movement, we wouldn't want to inject them in your lips because you need to be able to move your mouth. You need to be able to talk, right?
Mm-hmm. Oh, yeah.
Rolling. So places that we injected are the glabella, okay? Bunny lines on the side of the nose here. The entire forehead.
I'm making my mad face right now.
And then our crow's feet. So whenever we
I don't have those yet.
We create these lines that are called crow's feet. Crow's feet. Another area that we inject, like Ashley mentioned, is our chin, and then also back here to slim the jawline. So this is also a very popular area that we do just to help create a little bit more of a V shape, and we combine it with fillers and things like that. So, but in here is also another popular place. Okay. So those are the common areas. So forehead, between the brows, crow's feet, down here on the jawline, and then the chin.
And today we're only talking about cosmetic stuff. I mean, there's been people try to put Botox everywhere. It's been FDA approved for hyperhidrosis, but that's a whole other story, and you need a lot of Botox for that.
Exactly.
And then so it's been approved for migraines somewhat. We don't really do all. I mean, we're trying to look cute. So this is about the cosmetic side of Botox.
Trying to be wrinkle free.
Which reminds me.
Wait, pause. Let me make sure we got. Okay. Let me ask.
Let's
one more for the last question, and then we're gonna go into being wrinkle free. Okay.
So, Jess, how long does it typically last?
So that's a great question, Ashley.
Yeah, it's on the board.
I know. I made the board. Okay, so how long does toxins last?
And this is actually. We just got some new information.
Yes, so this is just as far as the studies go, upon FDA approvals, things like that. Of course, we only inject things that
I never thought when I was young in elementary school and they would talk about the little pyramid. I never thought that the FDA would be so important in my life. But it's like Dr. Stukar is not going to even consider anything to bring into this office unless it has studies, unless it has FDA approval, unless it has the data behind it.
So toxins are indicated to last, on average, about 3 months. I will tell you that
everyone's different.
Yes, everyone is very different. As soon as it's injected, it begins to work with your metabolism. So most patients get about a 3-month window of time out of it. Some patients get 3 to 6 months, but we're not going to tell you it's going to last 6 months because that's not what the indicated time frame is. The indicated time frame is about 3 months. Now, we did get the data back, and it was proven over and over again through all their studies that Jeuveau typically can last a bit longer.
4 months. The others. Yeah. They're saying 4 months is their time. So instead of, if you keep up with it, if you're on your schedule, put it in your calendar, which we definitely encourage that, and we'll talk about the membership or whatever. But if you're doing it on a year-by-year basis, Jeuveau would have you coming in 3 times a year, whereas Dysport or Facebook Botox would have you coming 4 times a year.
Yeah. And this is their studies. This is the data that's been approved by the FDA. So some patients, it could be 3 months. Some could be 4.
So also another thing that a lot of injectors do, a lot of doctors decide to do, is alternate, so that your face, your body doesn't get used to one thing and then stop working.
And that's actually what I've been doing. So I've been getting toxins for about 11 years now, and I know I'm really not that old. I'm only like 12, so but 11 years since I was 1.
11 years.
Yep.
Wow.
I won't say how old I am.
I've been getting
it's
them.
Like 43 right here.
So I've been getting them for 4 years minus 3 months because come on, this is your happy anniversary.
Oh wait,
it was like last.
I know it was
2 weeks ago.
2 Sundays ago.
It was 2 Sundays ago.
This girl just had her 4-year anniversary 2 Sundays ago. She had like a day over 15. That's all that.
So I started at 11. We both started at
exactly
the same age. Okay.
Same time.
So I haven't been getting it as long as Jess, but what were you gonna say?
Oh, we alternate them.
We alternate them.
I actually started with Botox 11 years ago. And
because Botox is the one that everyone comes in, they're like, I want Botox. Like, I only want Botox.
And that term is very loosely used. It's just like when you go to, someone's like, hey, what do you want to drink? Like, I want a Coke. But I don't really want a Coke. I want a Dr. Pepper.
Right.
So you just kind of use that term. So, but I started out
because it's they're so smart. It's a toxin. Whatever toxin, Botox. Like, when you're first into the game, you can.
You got it. You got lots of skin.
And did you know that Dysport it was called Dysport in Europe, but here in the United States, when it was trying to get its FDA approval, it was called Relaxin.
What?
Because it relaxes the muscles.
I didn't even know that. That was some good info, girl.
I was pretty proud of myself for that one.
Okay, so I think those are probably the most common frequently asked questions. You can always call and we will answer them. And of course, when you're here for your visit, we'll assess, what your need is.
Yeah, and sometimes, you call in and you say, I want facial fillers. Well, but your problem is going to be fixed by toxins.
Yeah, maybe.
Or vice versa. Like, I need Botox. I need it. And then what you want is more fullness or something.
Exactly. We'll decipher through that.
Yeah,
and see
exactly.
What's going on, what your goals are. Not me and Ashley.
Even our receptionist, the lovely Miss Courtney, is like really learning super fast. She hasn't. It's almost 3 months, and she's already got the hang of it. She knows
with all this knowledge, and we love her. Shout out to Courtney. When you call our office, you'll get that Sweet Things voice answering the phone. So
yes.
Hey, Barbara. Aw. Okay, let's see what's up with it. Okay, so Angela, I'm assuming you're asking what's up with it. What we were talking about, wrinkle free. So should we just end on that note?
What is next week?
Exciting things. Next week, June 24th through June 28th. Are you ready for this? Is there any reason you wouldn't suggest Botox? No, there's no reason.
If you are under 12 years old. No,
yeah,
just kidding.
You just have to be.
No, we don't treat anyone that's under 18.
Yeah, for cosmetic.
You have to. Yeah, no.
Toxins.
But
okay, next week, June 24th through June 28th is going to be what week?
Wrinkle Free Week.
And tell me what happens during Wrinkle Free Week here at the Clinic for Plastic Surgery. What is happening with this new tox next week?
Oh, wait a minute. Are you ready for this?
Hold on. But before she says it,
yeah,
do not tell Dr. Sugar.
No, and let's do the code word thing when you call.
Okay, yeah. Okay,
just say #NewTox.
New Tox is the code word. Okay, when you call this next week to come in for Wrinkle Week Free Wednesday, use the code NewTox. Just tell us that on the phone. We'll be on the DL. Okay, so what's going on? You say it.
We're going to offer NewTox Jeuveau
for how much?
$10 a unit.
$10 a unit, y'all. This is ridiculous. You can't miss this. Okay.
Shout out to our rep for teaching us everything. We had lunch with her yesterday. She's amazing.
Yes.
We're equipped to answer any of your questions on Jeuveau.
Yes.
And we are so excited.
Yes.
And that's why we want everyone to try it. We want everyone to.
We know you're gonna love it. So come in next week. Well, you have to call and make an appointment because we are busy. We have limited spaces. But call today even, or next week to get your appointment for next week. Wrinkle free. I almost said winkle free. Why is it like tongue tied?
Winkle. Like Rip Van.
Winkle.
Yeah.
Wrinkle free week.
Wrinkle free week.
Yes.
And I think what I'm gonna do is I'm gonna whip up some of these cocktails for next week.
Hey, look at that. We
And we'll do.
these bad boys. Okay.
We'll definitely do.
Wearing white, so we gotta be careful.
I know. I should not have worn white, but we'll definitely do some.
Week. Okay.
Yeah.
If you come in for
Cheers.
Jeuveau next week, the Neurotoxin, you're gonna get it at $10 a unit.
Mm-hmm.
And you may have a drink by our mixologist Ashley.
Yes.
So
Jess and I will come happy hour.
Serve you up.
Yeah, let's just go ahead. We can do happy hour
all week.
All week.
Starts at 8 a.m. Monday morning.
But actually,
5 o'clock somewhere.
We're not
I'm just kidding.
drink at 5.
No, we wouldn't.
I mean 5 a.m. Why did I think 5 a.m.?
I don't know. But
We're not gonna drink
I won't be here at 5 a.m.
No, girl. But let's do it.
Okay. All right. I know it's ridiculous. I'm so
Did
excited.
we talk about how many?
Oh no, we didn't. Okay. Last
Sorry,
note.
just last thing.
Note. Okay.
It
Squirrels.
varies. It's basically it varies.
Yes. Okay. So, one question that we forgot to address on the frequently asked questions is how many units do most patients need? That is going to vary depending on the area or areas we're treating
And how severe your
Exactly. I will tell you that an average toxin treatment is going to be about 30 to 50 units. Some patients need more, some patients need less. And I will tell you, it's pretty consistent across the board. Most men doing a full treatment typically
I was gonna say,
more,
yeah.
because they're, for whatever reason, their muscles are...
It's because they furrow so much.
They do.
Mm-hmm.
I'm like, bro, chill. You need some Botox.
Yes.
Mm-hmm.
Botox is definitely a thing. It's nothing to be ashamed of. It's
Exactly.
in today's society, you have to compete with the youngins
Mm-hmm.
that are wrinkle free. So,
And I'll end
Come
this
on
note
in.
with, I am, what do we say, 7 days? 8 days post Jeuveau. I'm not creating any lines or wrinkles.
but she still has that emotion.
Yep, so my kids will know. Get that brow going. Okay, all right. You guys have any questions for us before we say ta-ta for now?
I think we're good. Please continue after you watch this. Share, comment, and let's give away how many units can we give away of Jeuveau?
Let's just do whatever we want to do.
Okay, well you
I'm
gotta
just
tell them.
Okay, let's give away. Let's see. Okay, so let's pick.
I think that in my glabella, it's
You do
usually
about-
about 20, 25.
20, 25.
Yeah,
So
let's do
you
that.
Do you want to do 25 units?
Let's do 25 units.
All right, so get to liking, hearting this video, get to sharing. Make sure that you do follow our page. We do giveaways. We do fun PS shows with Ash and Jess.
And we are let's hold ourselves to this. We're gonna do them on Fridays.
Next
so
Friday's the
tune
28th.
in on Fridays at 12-ish, which oftentimes is 12:30.
Yes, so just have your lunch hour open and ready to watch, man.
And get your cocktail ready.
Aw, Madison, you are so sweet. You two are so beautiful.
Aw.
I love you. Okay,
We love y'all.
All right, so this is the PS show with
Ash.
and Jess. And
See
remember,
you next week.
PS, beauty's in the details.
Beauty's in the detail. Damn it.
I know.
Can we rewind?
I don't know if you can say that word on Facebook
Oh.
Live. We might get in Facebook
My
jail.
mom is gonna be so upset.
Take it
I'm
back.
sorry, Mom.
She apologized.
Bye, everyone.
All right, Shannon, give us a holler, sister. Shoot me a message, and I'll get you scheduled. Love you guys. Bye.